Well, good evening and welcome. I'm excited to see everybody today. For those of you who don't have your cameras on, please turn them on. It's much easier to speak when you know you're not talking into the void. In fact, that's how we hold all of our Zoom lectures during COVID, is that all of the students present had to have their cameras on. So I'd ask you guys this evening. So like Ms. Tilly said, I'll begin with a small presentation, just general facts about our program. And then I usually like to keep it somewhat informal, but because Zoom can be a little skittish whenever multiple people speak, it's hard to tell. We'll have a Q&A session afterwards, all right? So without further ado, I'll go ahead and get that presentation going. For those of you who don't know my credentials, I'm the academic coordinator for the FranU PA program, as well as the admissions director. I've been in this role since 2016. And so this is my 6th recruiting cycle and go through with the admissions process. So our name is Franciscan Missionaries of Our Lady University. This is the PA program. So if you're looking for PT or something else, you're in the wrong place. A little bit about our profession. I'm assuming if you're here, you probably know some of this. Is a PA is one of the most up-and-coming jobs, not only in Louisiana, but nationally. Forbes magazine has had the profession ranked in the top 5 the last 5 years. In 2 of those years, we were number 1. And so not only are we happy with our jobs, our patients are really happy with us, and that's the most important part. So you can see those numbers at the bottom that over 90% think we improve the quality of healthcare and make it easier for healthcare, and they trust us as well. So the numbers really support our profession, and they continue to grow. And I think that's going to show statewide and how our autonomy is getting broadened. Here's our mission. We are a mission-centered program, and so that's what we look for in our applicants. And so that's one of the most common questions that I get asked as the admissions director is, what exactly are you looking for in a student? Well, we want a well-trained student who makes good grades, but most importantly, we want someone who's mission-centered and is committed to serving all of God's people. Those are our core values: so service, reverence, and love for all life, joyfulness of spirit, humility, and justice. And these kind of core values are intertwined within our program and how we teach and how we do things at the university. So student life, it's easy to get into the nitty-gritty about books and expectations and GPAs and things like that, but life does happen outside of class. And so there's a lot of opportunities on our small campus you can see the crawfish boil on the right. They have a welcome week every semester for those who are incoming. There's a weekly mass and campus ministry for those that want to partake. And so another common question is, do you have to be Catholic to attend the university, or do you have to attend mass? We're not an indoctrinating program, so how you choose and what you practice religious-wise, whether it be atheism, Judaism, Sikh, then it's really up to you. So don't feel like that the Catholic university, it's the opportunity is there, but it's not expected if that's not what you want to participate in. On a different side, we have turkey bowls. So they take frozen turkeys and they throw them at bowling pins, and that's always a good time. There's a chili cook-off. And so you'll see lots of emails about what the activities are on campus. Usually about once every month, there's an opportunity for free food, which students typically enjoy. PASO, the Physician Assistant Student Organization, is our core organization. And so every student has the opportunity to join that. So there's community service, there's fundraising. Every year, the students raise enough money to at least get one white coat for their white coat ceremony, so they don't have to pay for it. In some years, they've raised enough to get 2, so that's a big part of it. And then it's team building. You'll find that when you're enrolled in PA school, you're enrolled with 30 other people, and 29 other people. Our cohort size is 30. And they're really your battle buddies. You have to rely on them to help with information, and you have to trust them to help get notes and things like that and collaborate. So really it does a lot of team building as well. The Student Government Association has 1 elected graduate student representative, and so they elect someone to represent all of our graduate level programs. And so if you're interested in that opportunity is there. We also offer student support. So PA school is hard. I don't think anybody that would recruit you would make any bones about that. And so because it's hard, it's anxiety inducing. And so we know that and have come up with an endowment that pays Mr. Logan McElwain to meet twice a semester with our didactic students. And we call it wellness rounds. It's basically like group therapy. And so it happens organically. The students decide what they want to talk about in the time they have. You're divided into small groups. So it's a little bit more of an intimate setting than everybody venting at once. And so the students absolutely love him. He's been dubbed Saint McElwain just because of how much support he provides for our students. And he provides opportunity outside the wellness rounds if there's any need for more therapy or follow-up from a psychiatric standpoint. Here's our core faculty. So that's myself, Dr. Deo, and Dr. Carter right there in the picture. We also have not seen is Dr. Michael McIntosh, who's our clinical coordinator, and Dr. Michael Ludwig, who we share with the DPT program as our anatomy professor, and he's part of our core faculty. So those five are considered the core faculty of the program. In addition to us, we have adjunct faculty. So Dr. Brian Galafaro is our medical director. He sits in on faculty meetings and helps us make major decisions, as well as gives guidance to find clinical sites. Dr. Micha is our physiology instructor. Mr. Case Rapollet is our radiology instructor. Dr. Jason Cavalier is a PharmD who teaches both of our pharmacotherapeutics classes. Jessica Tomplay teaches clinical laboratory medicine, and she was a clinical lab scientist before she became a PA, so she does a terrific job there. And then we have Miss Alicia Brand, Mr. Mike Falba, and Miss Melissa Lemoyne, who are adjunct faculties throughout each different semester and take different lectures and are kind of sprinkled in throughout the entirety of the didactic program. So we like to produce competent graduates with a rigorous curriculum. There's comprehensive summit evaluations at different checkpoints throughout the program. So at the end of the didactic phase, there's a summative exam. There's a summative exam to say that you can graduate. So there's different benchmarks that you have to meet in order to be considered safe for clinical practice. And so we try our best to make sure that everybody's prepared and ready to take on that venture. Our PANCE pass rate is pretty terrific in my opinion, and I think that is not just a biased opinion because obviously I love our program, but when you compare our numbers nationally, they really stack up well against good competition. So in the time that I've been here, there's only been one student who I've taught from beginning to end, and that just, I'm talking about myself, but I'll say this for the rest of the faculty. We've had one student not pass the PANCE, which is our board examination on the first time. We currently have our 2022 class taking the PANCE, and so of the 29 in that class, there's been 21 that have taken it, and all 21 have passed on their first try as well. So fingers crossed for the last 8. But I'm feeling pretty confident that we're going to get there for that'll be 2 consecutive years in a row, and then 5 of the last 7 years. Here's our curriculum. I'm not going to go by class, but what you'll see sprinkled in is FCMS. This is the 4 classes that teach organ block systems. So where you learn cardiology, where you learn orthopedics, where you learn pulmonology, are taught in those foundations classes. And so it's 4 didactic semesters and then 3 clinical semesters. The order of these changes from time to time depending on what the needs are of the university, because we teach, and you have dedicated classes for PAs, but some classes like research methods and bioethics are taught from an interprofessional education standpoint. And what that means is you have other graduate students in those classes with you. So nutrition, DPT, maybe CRNA are all kind of sprinkled in some of these classes that are universal across the university. So we use some state-of-the-art technology. The anatomage table is our favorite thing to brag about. It looks like a big iPad, and there's a picture coming up. And what this does is our answer to a cadaver lab. So cadaver labs are expensive, and they tend to be wasteful of resources. So if one person cuts something wrong, then you can't uncut that. When you use this giant iPad, then you can make cuts multiple ways. You can make mistakes, and none of it is high risk. And so anyway, I think when you see it, it'll explain a little bit further. We also use high fidelity mannequins and task trainers. This just allows us to kind of really bring in skills into the equation. So for example, we have a task trainer that you can do a genitourinary exam on a male and a woman. So it's hard to get standardized patients and people to volunteer for students to practice on those. So we have trainers that are meant to help you learn those skills before you go into clinical practice. So same with starting an IV. We've got a special IV arm that actually pumps fluid through it. And so you can see when the needle spikes and when you can get your blood. So anyway, those are incorporated in our program. Those are our mannequins and task trainers. We use a lot of case-based learning. So each instructor has a little bit of a different style. I tend to be more of a traditional sage on the stage type of guy. But Dr. Deo really loves case-based learning, and the expectation is you come to class having prepared for lecture, and what you do is you kind of work through some cases in a group setting and try to use that knowledge to incorporate it into a medical case or a medical problem. We utilize simulation, which is actually one of my most favorite things that we do in our program. We hire what we call a standardized patient, and this is a paid actor. So I tell them it hurts on this part of your abdomen, it hurts when you do this, it doesn't hurt when you do this, this is your story, and they get the guidelines and the narrative. The students get to go in cold, not knowing what the problem is, and so they perform a history, they perform a physical, they perform whatever clinical intervention needs to be done, all from a cold standpoint. So this gives them a very low risk. It's only worth 5 points, which is hardly anything in our curriculum. But so because it's low stakes, it gives them the ability to make mistakes without being a high stakes situation. So it helps us prepare for clinical practice and our checkoffs and things like that. I've already touched on interprofessional education. And so there's some classes taught that way. Simulation is done that way sometimes as well. And then last but not least, service learning. Again, we're mission centered. And so Dr. Carter has things in her class where you go take vital signs at different places and give back to the community. And it's part of a reflection and a grade in that course. So there's a picture of our anatomage table. The anatomy lab is very student driven. And so you guys get to play with it. And usually each group picks 1 or 2 people that they like to play with, and the rest kind of gives them instructions. And then Dr. Ludwig is always there to give guidance as well. And there's Eugene. That's our plasticized cadaver. So they've taken and split this cadaver in half and filled them with different fluids and plasticized them. And so that's another big tool that we use in the classroom to help identify anatomical features. All right, so simulation and labs. So on the picture on the left is called the room of errors. You can see the potato chips and the medicine left out there in the forefront of the picture. And so the students get about 10 to 15 minutes to go around the room and identify what the risks are in the room. Usually there's water on the floor. You can see almost all of the bed rails are down. So this is a fall risk too. And so we learn about, that's one of the different things that you learn in simulation. On the right, you can see that plastic arm that I was telling you about and the fluid that goes through it. So the students are learning to do IVs on the arm, and then they practice on each other, which is always fun. Here's another example of standardized patients. So for this one, we used kids of different ages. So my kids and other faculty members' kids, and we learned the different benchmarks and growth charts and things like that for kids of different age and what the expectations are and things like that. So the kids think it's fun and the students enjoy it as well. All right, so once you're done with the 4 semesters of the didactic phase, there's 8 core rotations with 2 electives, so 10 rotations total. It can be held anywhere throughout the contiguous 48 United States. And the reason for that is there is a nationwide lack of medical learning sites for medical learners. So MDs, NPs, everybody that is trying to get a medical education, there's a shortage of sites and preceptors. And so typically when we do have you travel, it's usually a very rich experience for the student. And I'll give one example. There was one young man who was in the class of 2020 who had to travel to Nashville for 8 weeks. And he loved it so much, and they enjoyed him so much, they just wanted him to stay. They said, just don't go back to PA school, we'll hire you. And unfortunately, it didn't work that way, but he did get a great job. But anyway, those are, I like to share that experience because when the people called us and said, hey, we love this guy, we want to keep him, we were very happy with that, but we had to finish his education first. We have developed an international rotation prior to COVID, and so that kind of squashed that. It's in Peru, it's an elective, and so if you get into the program, we'll have better information as to when and if that rotation is available. Here's your clinical rotations. I'm not going to leave all of them, but basically we try to touch on a lot of different things. If you have an elective and it's available, Dr. McIntosh does his very best to make sure that you get it. So the impact of COVID-19, the slide deck started in 2019. We were having to explain things, and luckily I've gotten to remove quite a bit of what the expectations are. So a little bit about our history. When COVID hit in the March and April of 2020, we had to go to an entirely online learning program. So all of our classes were online, all of our tests were taken virtually and remotely outside of class. And so that took its toll. And over time, we've steadily integrated ourselves back on campus. At this point, we are fully back on campus. And so we're very excited about that. And the students tend to be more successful and happier when they're in the classroom and we can answer questions in person. But this is a changing world. So yeah, I can't guarantee that that's not going to change, but that's our intention and that's our goal, is to always be on campus. The Zoom toothpaste, as I like to say, is a little bit out of the tube. And so for Dr. Cavalier, for example, this week doesn't have a ride and is teaching virtually. So Zoom does get utilized on occasion, though it tends to be a last resort. We've had students that recently caught COVID again. And so in those cases, when they're symptom free, we allow them to Zoom into class and watch the in-person classes. So we try to be as flexible as possible. So what's next? So you're going to put your application in through CASPA if you choose to apply. The core faculty and adjunct faculty do a thorough review, and once we decide all of our minimum criteria are met, we can extend you a personal or a Zoom interview. We're holding interviews via both this year. The setup for that is still in the works, so I don't have all the information there, but know that you could. It will be up to the student to decide whether they would want to be on campus or attend virtually. I would suggest completing your FAFSA. It costs absolutely nothing to do so and really speeds up the wheels for admissions should you matriculate into the program. And so FAFSA is the federal funding thing that gives you your loans. PA school costs around $90,000 all in to go to, and most people don't have that sitting around to just pay cash for this education. You want to make sure that you successfully complete all in-progress coursework. So if you find that you get in and you're taking fall classes, you can't just quit those classes. You got to successfully complete them. Create a Slate account. So you'll be getting communication through CASPA about the admissions department reaching out to you. And so Slate will be the primary way that we communicate. And so that's where Tilly and her gals will give you updates and communicate there. We have 3 different admissions decisions. One would be our first accepted, our 31st applicants by rank. Then there's a wait list. We don't disclose where anybody is on the wait list, how long our wait list is, or anything about that. That's all confidential. And then if you're declined for whatever reason, you'll be sent that notification as well. All right, so questions. If you get out of here today and decide, hey, I thought of this after Mr. Irwin was done talking and I want to ask somebody, usually by email is the easiest way to get to me. So Lisa Lucelot, who's our program support coordinator, manages the PA at FranU.edu inbox. And so she will forward any questions that she can't answer to me. And she's a great resource to us. And so you'll probably be hearing things from her about interviews during this process as well. There's Tilly's number, there's the Office of Financial Aid. And so questions that they can answer will be directed there. All right, that ends my presentation. And so I welcome any questions that you might have.
So I do have a quick question about FAFSA. So I'm technically graduating in December. And so if I apply to like FAFSA and say that like I'm still completing my undergrad degree and then I'm interested and like, let's just say I get accepted. And since it's kind of like the middle of the academic traditional year, would that affect, or would I have to go back in and change it midway or after my undergrad degree?
I don't know the answer to that question. Tilly, do you know?
So it's been a while since I've done the FAFSA, but you're already in an academic year. So what you would be submitting would be for a future academic year. So that's why it's no harm, no foul. Like it's almost like you're kind of doing it ahead of time. Now, whether or not it's open right this second or it's open in the coming weeks, I'm not sure about that because, you know, they all have windows just like CASPA does when you guys submit your applications, and then it closes and it opens. But you would be submitting for a different academic year, and you're also filling it out as a graduate student, not an undergrad student. So it's also a different series of questions that you go through. Or like when you get to that question, it does ask if it's for a graduate program. So you definitely don't want to open a current FAFSA and update it. You want to make sure it's for a new academic year. And then we all know PA school is competitive. So, you know, if you choose to go somewhere else, or, you know, you have other schools on your radar, you are able to go into those FAFSA and update the schools as needed. So, but just make sure you're not updating a current one that you're in right now. And if you have any questions, check with the financial aid office at the school you're at.
That was my direction.
Thank
Yes.
you. Thank you. And I have a quick question about Slate. Is that like an app or a website or both?
I was about to jump in on Slate, so everybody listen about Slate. So everything you guys are going to do for your PA application is through CASPA. At the time that Ben and the admissions team makes their selections on interviews, you are going to see an email come through that'll say, it'll say something like, we know you have an application through CASPA. Please create this account so you can view your future decision. So you're going to get an email from us, from the admissions team. It's going to have some instructions, and it will have a hyperlink for you to click on and create that account. So just make sure when you all get that email, if you're applying for this academic year, just read the email, because it does tell you how to reset your password and direct you to Slate. But there's nothing that you all can do right now for Slate. Just follow your criteria for submitting your CASPA application. But look out for that email from us in, I'm trying to think of when those emails should start coming out soon. But again, it'll give you instructions. And if you have questions, you can reach out to us in admissions. Did that answer that, Ben? I think I did. Okay. Make sure you do your CASPA application. Don't worry about Slate just yet, just till you get that email.
Are there graduate scholarships available at FranU?
Not to my knowledge. We previously had an endowment where each clinical student received a stipend. So they told us we could give all of it or some of it to one person. We didn't feel like that was very fair. So we elected to disperse it among the clinical students to help any travel costs that they might have. I don't think that endowment exists anymore, but that's a good question. There are scholarships outside of our university that students have applied for and gotten. I don't think it's for the full amount, but if you find one and you need our help to try to complete it, then we'd be happy to help.
And Grace, I think on the FranU webpage, on the financial aid tab, I think this year we recently added a link directly for some PA scholarships, but again, it's outside of the university. But I do believe the director of financial aid just posted that link up on the financial aid webpage. And I saw somebody raise their hand, but I did not catch the name, so you can jump in. Oh.
I had a question about housing. Is there any housing options at the university?
There are no on-campus housing options, though we are pretty centrally located in Baton Rouge. So there's apartments like directly across the street from our university, and there's a lot within the area. So if you wanted to be close to campus, there's opportunity there. We're about 10 minutes down the road from LSU, and LSU has tons of apartments that are around there. So we don't have any direct on-campus living options, but there's a lot of opportunity within very close driving distance.
And our student affairs team has also recently implemented a website for, well, it's a portal for admitted students. So that information goes out once students receive acceptance, but it does offer some, I don't want to say recommendations, but apartment availabilities. And some of those apartments may offer discounts. They may, in terms of discounts, it might not be anything to write home about, but a lot of times the students do like the modified agreements in terms of the lease term. So they might be more willing to work with your lease term instead of like your standard. But the student affairs team sends out that information for that portal. And it is a place for you to look for apartments and in some cases roommates, but we're not matching you or anything like that. It's kind of open group where you might find someone that's looking for something.
Do y'all have a certain score for the PA CAT that y'all looking for?
So we take PA CAT scores, but we don't look at them. as of yet. We're retroactively looking at them to see if there's anything predictive. So if you want to send us your score, you can, but it's not used at all in the admissions process. So we accept the scores, but we don't use them in any type of scoring format. Linda Hamad.
I have a question regarding the GRE. So I've taken the GRE, but I would want to retake it to get a better score. If I take it early July, is that too late to get it in?
Most likely. It takes a while for CASPEL, one, to get the scores, and then two, verify the scores. So that would be really close to our August 1st cutoff date, because you have to have everything verified. If you're taking it just to get a better score, I would tell you not to take it, because if you meet the minimum criteria, I don't recommend taking it again. So if you've scored above a 290 on both the verbal and quantitative sections and made over a 3.5, I don't think it's worth your time to retake it.
Okay, thank you.
I know it says it's required to take OChem 2. I'm currently taking that in the summer. I'm just scared that my final score is not going to be in by August 1st because the class technically ends July 31st.
So that's okay. So we accept applicants with in-progress coursework. So let's say you're a December graduate and you're going to take biochemistry instead. So you could be matriculated in the program, but that would be contingent on you successfully completing that class. So even though your final score may not be there for Organic 2, as long as we can verify that it was successfully completed with a C or above, then it wouldn't matter. Any other questions? I saw Miss Carter made it. Hey, Miss Carter. You're on mute.
Sorry, apparently I've forgotten how to use Zoom. Zooming is not one of my favorite things, but it has been very, very useful. So sorry that I was late. I was finishing up a class, but everything went well. So I'm excited to see all your new faces, and I want to wish you guys luck in this endeavor and in your application process. And I look forward to the opportunity to go ahead and meet each and every one of you. Did I need to have to say anything else?
No, that's it. I saw you came, so I wanted to introduce you and let everybody see you. Smiling face. I'm glad class went well. All right. Any other questions?
I have a quick question. I was wondering, do y'all do like substitution classes? Like if you don't take Orgo 2 and if you took like biochemistry instead, like does that kind of work or no?
So that's the one substitution we allow, is biochem for Organic 2. So all of our prerequisites are listed on our website. I encourage people, every time I get asked this, is use our website, print out that page or copy and paste our admissions requirement and use it like a checklist, because it's meant to be transparent and exactly what we expect. There's a few cases where life experiences will substitute for a prereq if it's greater than 7 years old. So a good example would be a student took all the prereqs except organic because he was an organic chemistry teacher. And so we knew that he knew organic and had the prerequisite skills because he had been teaching organic chemistry for like 5 years. So that's a great example of when we would allow a life substitution in place of a prerequisite.
I just have a question. So about like applying. I'm going to be applying next year. So I was just like wondering if you have any advice on how to like have an application that stands out, like things to do, like I guess work, volunteering, like things like that. Like what advice you would give?
So I can't give any specific advice because that would give one applicant a little bit inside edge of the other. But I understand the intent of your question is how do I make one the best? And so there's not one thing that we hang our hat on. So we love students that have community service and volunteer work. That's a mission center person, but that's not that one thing wouldn't put you above another applicant who has other considerations. So patient care experience, PA shadowing hours, There's multiple other considerations we give. And so it's a constellation more so than just like, all right, this is one thing that we look for, let's check that box. And so it's very much, it's not holistic in the sense that we don't measure and grade those things, but it's holistic in the fact that we look at a multitude of different factors and things we want to look at for prior to admission. So there isn't one thing that I could tell you. Just make sure that you follow instructions and are transparent about everything that you put on there.
Also, so for next year, I know you probably don't know the answer to this question, but do you think that there will be like a score for the PA CAT by like next year that y'all would be looking for, or is that kind of up in the air still?
I don't anticipate us using the PA CAT as a benchmark for admissions process in the next cycle.
Thank you.
You're welcome.
Do y'all offer interviews prior to the deadline, or you only offer interviews after the deadline?
We've tried it different ways in the past where we started the interview process in June. I don't think that's going to be the case this year. It's typically starts after the verification is done, and we've got our pool of applicants and divide out our days for interviews. So it could potentially happen before August 1st, though I sincerely doubt it. Hello, Mr. Epley.
Yes. So I graduated from LSUE in 2019 in radiologic technology. So I only have an associate's degree, so I'm kind of far from the PA, application process. But is there any benefit to prereqs that, graduating recently within the past few years? Is there any are there any classes that would possibly transfer over? Because I took anatomy, physiology, lab, lecture, physics, things like that. Is there any advantage to that, or am I going to be starting from pretty much ground level, ground zero?
I don't think I understand your question. So you've taken some of the prereqs, but you need to complete your bachelor's degree. Is that correct?
Correct. Yes, sir.
If I understand, because I think we've been talking, Jason, he has an associate's degree and is already working in healthcare, right?
Correct. Yes, ma'am. I've been at a urgent care for 2 years and a hospital for 1 year previously.
So are those prerequisites greater than 7 years old?
No, sir.
So as long as they're 7 years, as long as you apply within that 7 year time frame, they're good. So that's what we look at. So you wouldn't have to retake those, but if you haven't taken the prerequisites listed on our website, you would have to take those in addition to completing your bachelor's degree.
And
Okay.
What is your associate's degree in?
Radiologic technology.
That's
rad
right.
Tech, X-ray.
So you have you're a little bit different than students that are, just have their associate degree. So you might want to look for, there'll be like completion degrees, kind of like a nurse can complete a RN to a BSN. And there are probably some opportunities out there for you to complete a BS degree with a lot of content online. But as Ben said, you're going to need to make sure the prerequisites, you kind of sprinkle those in there. If you're missing something like organic chem or something like that, you might have to add into that program or take it, at another university. But there are completion programs out there for your situation. We offer one that you can finish that bachelor's degree. So we can chat later. I know I saw your email. I just hadn't gotten to it today. So we can chat tomorrow.
Not a problem. Thank you so much.
I know one question, Ben, we get a lot, if you want to talk about the EI. I know last year that was a new requirement, the CASPER, right? I don't know if you want to just briefly touch on making sure that that's done as well before we get a lot of questions about that.
Okay, so what is CASPER? CASPER, not CASPA, ER at the end like the ghost, is a situational judgment test. It's got 10 domains that it measures. It's given over the course of a couple of hours by 10 different people. So you have 10 different people grading it whenever you give your responses. Some of the responses are answered in person via Zoom, and then some of the answers are typed or written out. And so they measure these and it spits out a Z-score. We use that Z-score to help give us some guidance on how this test measures a person's soft skills. So how their empathy, how they communicate, are they trustworthy and things like that. And so the website will have all the 10 domains that it measures on there. I'm sorry, I don't have them memorized, but anyway, so it's a situational judgment test. You have to take it prior to interviewing. And so the dates are on our website. The link to take the test is on our website. And so you can register there. It's a third-party system, so it's not delivered through CASPA. We take and we look at the scores independently of that and use them in our applications process or admissions process.
Any other questions?
Yeah, so this goes back to the interview question. So would FranU technically be considered like a non-rolling admissions program? And so it did.
We do not have rolling admissions. We admit,
Okay.
we usually send out our invitations somewhere between the beginning and end of October, and our classes start January. It's usually the first week of January. And so we take 30 students per academic year.
Okay, so there's no benefit or disadvantage to like applying early or late.
No. So either all are given equal footing. So there's 1 year we tried it a little bit different where we kind of admitted people as we were interviewing. But I think that creates a bad perception that if you interview early, then you're given preferential treatment or preferential consideration. And so that's not the case. So if you're the first interview, you're given as equal as the last interview. So there's no preference as to the student as to when they interview.
Okay, thank you.
Okay, or I
All
guess
right.
we're good.
Thank you all for coming.
Yeah, we will have this recording posted on the website. So if you need to reference back to it, we'll also email it out as well. So if there were any slides you want to go back to and see, you'll get an email with the recording. And just feel free to reach out to us if you have any questions. I'm Tilly again, I'm the grad coordinator, and I've worked with some of you. So I'm happy to help you along the way.